The Great Seal of North Carolina and the North Carolina Department of Health and Human Services logo is displayed. A disclaimer is provided, stating, names, characters, and contact information in this video have been created for the purpose of this tutorial video and are not real. Any resemblance to actual persons, places, or events is purely coincidental. A woman sitting on a couch in a living room with a laptop stands up and a speech bubble appears.
How do Medicaid beneficiaries request to move from a standard plan to a tailored plan? Just use this simple step-by-step guided process.
Green boxes and animated doctors are displayed. The screen displays standard plans meet the needs of most Medicaid beneficiaries, and the terms physical health services, behavioral health services, pharmacy services, and long-term services and supports are shown.
Standard plans provide health care services that meet the needs of most Medicaid beneficiaries.
Blue boxes and animated doctors are displayed. The screen displays some specialty services are only available in tailored plans, and the terms severe mental health illness, severe substance use disorder, intellectual developmental disability, I/DD, and traumatic brain injury, TBI, are shown. Tailored plans provide additional services related to conditions for individuals with a serious mental illness, severe substance use disorder, intellectual developmental disability, also called an IDD, and traumatic brain injury, also called a TBI. The outside of a clinic with people outside. A red arrow that says request to move appears.
Beneficiaries who have these conditions or need services only offered in a tailored plan use the request to move to a tailored plan process.
A laptop displaying the Submit Forms online page.
To begin the process, go to the Submit Forms online page at ncmedicaidplans.gov.
A laptop displaying the Submit Forms online page scrolling.
From this page, a beneficiary, legally responsible person, provider, or care manager can submit the request.
A laptop displaying the health plan change options and selecting the provider option.
If the requested service is needed immediately, it is strongly recommended your provider or care manager complete the process. They can provide information about your health care needs.
A laptop displaying the health plan change options and selecting the beneficiary option.
If you do not have an immediate need for services only available in a tailored plan, you will submit a request to move to a tailored plan beneficiary form. To begin the submission process, select the I want to request to move to a tailored plan. I am a beneficiary or their legally responsible person option.
The fields for the beneficiary form display and typing is shown in the fields.
Next, fill out the required information, which includes your name, date of birth, and NC Medicaid ID number, which has 9 digits followed by a letter and can be found on your NC Medicaid ID card.
A call center with a drop-down banner providing information and a phone number.
If you need help finding your NC Medicaid ID number, use the chat tool on our website or call us toll-free at 1-833-870-5500.
An arrow selecting the Start Your Form button.
Select the Start Your Form button to continue.
A scrolling screen displaying a list of tailored plan services.
Remember, you should begin this process because you have a condition that qualifies you for a tailored plan, or if you need a service only offered in a tailored plan.
A computer screen displaying who the form is for.
Check the I understand checkbox and begin the process by selecting the Start button.
The fields for the beneficiary form display and typing is shown in the email and phone number fields.
Step 1 of the process requests your email and phone number. Some information is pre-filled based on the information provided earlier.
An arrow selects the Next button.
Select the Next button to continue.
A computer screen displays the tailored plan conditions and services, and text boxes to describe a beneficiary's needs.
Step 2 asks about what services you may need. You must check at least one of the conditions or service types listed. Next, tell us how the condition you selected affects your life and what support is needed, such as I need substance abuse treatment. This example does not represent all services covered by tailored plans. Describe your support needs in the text box. Select the Next button to continue.
A computer screen displays fields to fill in provider information.
Step 3 requests information for a provider you have visited recently. A provider is a doctor, therapist, or other healthcare provider who has recently treated you for one or more of the services you selected on Step 2.
A computer screen is displayed to upload documents.
You can also upload documents to support your request. Select the Upload Documents button and attach as many as 10 documents related to the services you selected. Once you finish uploading documents, select the Upload button. Last, select the Continue with the Form button to finish the Request to Move process.
An arrow selects the Next button.
If you do not have any documents to attach, select the Next button to continue.
A computer screen displays the authorization page.
Step 4 asks permission to share your health information so that your eligibility for moving to a tailored plan can be determined. Select how much of your health information you want to share.
A computer screen displays the confirmation screen.
Step 5 requires you to acknowledge your request and allow North Carolina Medicaid access to your health care record to make a decision. Read the entire screen and select if you want to sign the form by text message or email before selecting the Send link to sign the form button.
A laptop displays an envelope and a pop-up email about signing the request to move.
If you selected to sign the form by email, go to the email address you provided and click the link within your email. Confirm the information on your form and sign the form to submit your request to move to a tailored plan.
A cell phone displays a message bubble that says, "Sign your request to move to a tailored plan form."
If you selected to sign the form by text, check your text messages and click the link. Confirm the information on your form and sign the form to submit your request to move to a tailored plan.
A call center with a drop-down banner providing information and a phone number.
If you have not received a link within 5 minutes, or if the email address or phone number listed is incorrect, use the chat tool on our website or call us toll-free at 1-833-870-5500.
A computer screen displaying additional information about what happens next.
Additional information about what happens next will be displayed depending on which option you chose.
A calendar with the number 7.
You will have 7 days from the date of the email or text message to sign the form.
A laptop displays an envelope and a pop-up email about the request to move being cancelled.
If you don't sign and submit the form by the 7th day, your request will be cancelled. A new request will need to be submitted if you still need services only available in a tailored plan.
A man sits at a desk in an office, typing on a computer.
Once the document is digitally signed, a decision will be made within 5 business days.
A girl reads a letter from a mailbox outside of a home with a speech bubble that says, "I'm approved."
If you are approved to move to a tailored plan, you will receive a letter telling you that you are enrolled beginning on the first day of the following month.
A girl reads a letter from a mailbox outside of a home with a speech bubble that says, "I'm not approved."
If the request is not approved, you will get a letter stating you will stay in your current plan, with instructions on how to appeal if you don't agree with the decision.
A call center with a drop-down banner providing information and a phone number.
If you have any questions, we can help. Use the chat tool on our website or call us toll-free at 1-833-870-5500.
The Great Seal of North Carolina and the North Carolina Department of Health and Human Services logo is displayed. A disclaimer is provided, stating, names, characters, and contact information in this video have been created for the purpose of this tutorial video and are not real. Any resemblance to actual persons, places, or events is purely coincidental.